Greetings. My name is Dr. Singh, and I would love to share some information with you about coronavirus that should prove useful. Remember, at the end of the day, your health comes first. In this video, you will gain a better understanding of how viruses actually work, why they are so difficult to treat, and hence the predicament that we are in. And importantly, I'll speak a little bit about vaccines. Before we speak specifically about coronavirus, I think it's good to lay some fundamentals. So let's speak about infections firstly, as this will give us an understanding of why we're in the predicament that we're in. Now, infections are essentially little creatures. We call them microorganisms. They're usually microorganisms in most cases. That means that you can't see them with the naked eye. And they can be on or inside our bodies. Now, if they make us ill, then that's when it's considered an infection. However, if the organisms are on our skin or inside our body, which we do have, and it does not cause illness, then it's not considered an infection. Now, as it pertains to infections, there are four major categories. They are bacterial, fungus, parasites, and viruses. Now, bacteria, fungus, and parasites have plagued humanity just like how the virus is causing a huge problem right now. However, at this point in time, we have enough understanding that we can create effective treatments for them, meaning we have treatment that can kill them and eradicate them from our systems. As it pertains to virus, we still do not have a wealth of information on viruses as yet, or should I say not enough information, because viruses have been notoriously difficult to treat. Even the simple flu or influenza, you will hear the doctors saying that we allow it to run its course. And by that what we mean is that we support the body itself, meaning keeping it healthy. If there is fever or anything like that, we treat the fever. If you're having any pains, muscle aches, we'll treat that. We'll keep you hydrated and allow the body's natural defenses, which is the immune system, to eradicate the virus. So in most cases, we do not have any medication that can kill the virus. And that's partly why we're in the situation that we're in. How do viruses actually work? Well, viruses are very interesting creatures to begin with. To this day, there's still debate as to whether it is living or non-living. And it's a little bit complicated, but I'll try to use the human body, the entire body, as an illustration of how normal cells work. And then I'll show you, in comparison to the human body, how the viruses work. And then I'll tell you exactly how coronavirus works, okay? Now, imagine that I am a single cell in the body, right? Just me, my entire body is just a single cell, okay? And what makes me function essentially is my brain and my mind, right? Now, my brain and my mind right now, I've decided to make this video for you because I think it would be beneficial. Now, I also have hands and feet and my mouth, I'm speaking, so I have the machinery necessary to do this. Viruses, if we're making that comparison, does not have a complete body, put it that way, right? They essentially just have like a mind and a brain and some other little parts, right? I think that's a good way to look at it. Now, what these viruses do is that they will just be sitting down, just there not doing anything. Now, if I should happen to come into contact with the virus, right? What the virus would do essentially, and this is just a comparison first, using the human body as the cell, right? What the virus would do now is attach itself to my head, right? Convince my brain and mind now to do its bidding. And let's say the virus just wanted me to make cheesecake all day. Then instead of making this video and doing my normal daily chores, I would just start making cheesecake all day. So how they actually work, now that you understand that they do not have their own machinery and that they require other cells to carry out their functions, we have a better idea. So imagine like viruses have spider-like legs, and what they do is that when a cell that passes by or they come in contact with that they can infect, what happens is that They have like spider-like legs that attach themselves to the cells, and then they like essentially drill a hole into the cell and insert information, which is the genetic material, right? They insert the information now into the cell, and it becomes one with the cell or the brain of the cell, and now convinces that cell to not carry out its normal function but to make more copies of viruses. And that's essentially how viruses work. In most cases, when viral copies are made, the cells are destroyed, and then those viral copies now, so one virus could lead to quite a few viruses, and then those viruses now do the same thing to the nearest cells close to them, and they just keep reinfecting and reproducing and reinfecting and reproducing. Now, as it pertains to viruses again, so let's explain now how coronavirus affects the human body. Now, the virus won't just infect anywhere it touches. It's like Apple products. They have special ports and they'll only attach to those ports, right? So as it pertains to the coronavirus, it is a respiratory tract infection, meaning it will infect anywhere from the nose, going back to the back of the throat, back of the mouth area there, down into the trachea, or as they call it, the windpipe or the wrong throat. And then it will go down also into the lung, all right? So anywhere from the nose all the way down to the lung, that is where the coronavirus infects, all right? The respiratory tract, that breathing. It is that area that brings oxygen from the atmosphere into our lungs and hence into our blood and to the rest of our bodies. So as you can imagine, it can be quite detrimental if you affect getting oxygen into the body. If you understand where it affects now, then you understand that the person will have, like, for example, runny nose if it infects that area. And if it goes to the back of the throat, they can have sore throat. And then when it starts going down, into the trachea or the windpipe and then into the lung, then they obviously can start having coughing. They can be producing, that yellow, let them call it the yellow coal or the phlegm, or green, depending on whatever. Well, to be honest, when that starts happening, a bacteria superimposes on that infection, but we can leave that for now. So when they start coughing, you can start producing phlegm, as they call it, or coal, right? And as you can imagine, it can also lead to chest pain and shortness of breath, because it's going to affect those areas. Then if the person becomes even more ill, then they can affect the rest of their bodies. And that's a different process, but that's when you become severely ill. But for the most part, it affects from the nose to the lung. Now, at this point, the next question should be, then why do some people get more ill than some? And this is where we need to speak about the body's defense, which is the immune system. Now, the immune system is a very complicated system, but essentially what happens is that when viruses, or as you know the word infection, when any infection occurs, the body will recognize that this little creature or microorganism should not be here. And then through a series of processes, it will identify that it is not supposed to be here and devise a strategy as to how to kill it. Now, depending on how long it takes to kill it, that will result in how the patient responds to the illness. So in patients that respond quite quickly, or they don't even know that they're ill, that means that their immune system was able to detect the organism and create a way to destroy it quite quickly. In cases where the infection gets so bad that it finally gets down into the lung and causes shortness of breath and sometimes even death, it means that the immune system did not respond quickly enough to eradicate the illness before it got a chance to really multiply and cause that amount of damage. So it all boils down to the immune system. So at this point, we can discuss whether this coronavirus is truly a threat or not. So let's look at it. I think one way to really assess its severity is to compare it with another respiratory tract infection. So let's look at influenza. Now, influenza affects over 1 billion people per year. Believe it or not, it results in about 5 million people becoming severely ill and about 350 to about 600,000 people dying per year. But look at it. We don't see it on the news. The hospital systems are not overwhelmed, and most people that get it resolve based on what we have seen. Now, with coronavirus, remember from the onset, well, by the time it got to like about Italy, remember that serious protocols were put in place. So we did try to limit the spread. And yet, look at it. It's already, I was shocked to see the number today. It's at about 23 million, right? And it has passed the 650,000 deaths that occurred in influenza that had 1 billion people infected. Now we are at 23 million and we are already past the death cap. So we can see that this virus is highly infectious, meaning it spreads quite easily. And not only that, it has a higher death rate than influenza. And we have to think practically as well. The hospital systems in most cases are overburdened. And you have to look at it as well where your health is concerned, right? You do not want to get to a point that you become severely ill and then have to go to a hospital that is overwhelmed and overburdened. And remember, I am a Caribbean person. I am from Jamaica. And the hospital system as it is already overwhelmed, right? Now, you do not want to be in a situation where there is this pandemic that exists and then you're going to add to that burden. You yourself will not get the appropriate care that you desire. Even in first world countries, they were having issues in delivering proper health care. So when we put everything together, I do believe that the best thing to do is to really try to prevent getting ill. So at this point, let's talk about what we as individuals can do for ourselves, our families, and our neighbors. So what they have put in place is actually quite good, I'd agree with, in terms of social distancing, face masks, and maintaining infection-free hands, right? Now, as it pertains to social distancing, we know that it is a respiratory tract infection, that it affects the nose all the way down to the lung. So by talking, coughing, sneezing, and that type of thing, we know that we can transmit the infection. So it only makes sense that the further we stay away from someone that potentially has it, the less likely it is that we would contract it. Because all these measures are based on a risk. We are just trying to decrease the risk of us contracting the infection and then spreading it to others, right? We have to look now and make sense of it. So if we know that, for example, your family, we have been together and we are not infected, then we do know that in that case, we do not need to take any of the precautions because none of us has the virus. If we know another family, for example, that are taking all the precautions and have been infection free, and they're able to drive in their car straight to our homes, for example, we know that we will not get the infection because they have been infection free, for example, for 2 weeks, and I have been infection free, for example, 2 weeks, and I have not done anything that would have put me at risk to contract the virus. Then I can safely visit my family and still maintain that social connection with them without contracting the virus. So it's not just that we always have to be 6 feet apart away from people. Now, as it pertains to like parties and those huge gatherings, there are lots of strangers. We do not know if they are taking the necessary precautions. We do not know where they have been, and we do not know if they are currently ill. So in large crowds, the chances or the risk of us getting infected is greater. It's definitely greater. As it pertains to face mask, again, this is just reducing the risk. We know it's from the respiratory tract, so by covering our nose and mouth area with a simple face mask, it's usually good enough because it decreases the risk. Now, it's not that, like I said, it's 100%, but social distancing in addition to the face mask, that's an additional chance of us reducing the risk of us spreading or contracting the infection. And as it pertains to clean hands, as you can see, my hand may be touching my face a lot, and so it's quite likely now that if I should touch you, or shake your hand or give you a hug, then it's possible that I could transmit the virus from my respiratory tract to you, which is not quite what we would want. So that's why they mention about regular hand cleaning. Now, a precaution here again is that too much hand cleaning can actually dehydrate your hands and lead to small cracks and can actually lead to an infection of the hand or just poor skin health. So we do not want to be overdoing it. When you want to necessarily clean the hands is, for example, when you go out into public and you are returning to your car or to your home, you definitely want to clean because you have definitely been in touch. You have maybe been opening doors or touching pads and surfaces that have been touched by many other people. Those areas are high risk for contracting the virus, so you definitely want to sanitize after. And they haven't recommended it, but if you feel like you would want to wear gloves in public, then that would also be fine, and then you could remove the gloves before re-entering your car. Now, you can see that the immune system is what is actually paramount in clearing the virus should we get it. So there are a few things that we can do to boost our immune system. And when we say boost our immune system, what we actually mean is to have your body at a healthy state. Your immune system can function normally. It's not that we can bring our immune system to a super state that it will just destroy everything. No. All we're trying to do is to carry our immune system to its normal healthy state. We need to have a balanced diet. And please, we need to increase our fruit and vegetable intake. Regular exercise, I cannot stress the importance of regular exercise. Wow, exercise does so much to improve one's health, and it will also improve the immune system. So if you haven't been exercising, I strongly urge you to start exercising. Start slow and gradually become more fit. I will have future videos on these topics, but right now I'm just encouraging you to have a balanced diet and regular exercise. Also, we need to have healthy sleep cycles. I can tell you from working in the medical system during those night shifts that not having a proper sleep cycle can really affect your immune system. All right? Yeah. This part is a little difficult, but if you can reduce the stressors in life, then that will also help to boost your immune system. And by stressors, I mean it can be emotional stress, it can be physical stress, like work and that type of thing. But if you can remove stressors out of your life, it will help to make your body in general function better and hence your immune system. Now, let's talk a little bit about vaccines. I know that there are a lot of mixed feelings as it pertains to vaccines, but let me just ease your anxiety in saying that I believe that vaccines are going to be probably the best way of controlling this coronavirus. And so it's in development and hopefully it comes out soon. Remember, it was vaccines that eradicated smallpox, and trust me, the little children, the kids were they were at great risk as it pertains to infection. So the vaccines, as you can see, most children have been vaccinated, right? And that's why they're able to grow up now infection free and free from so many complications, and even the death rate has improved because of vaccination. So vaccinations are really good and they're really helpful. Now, I'm not saying to get vaccinated for every single thing, but for the important infections, I strongly believe that vaccinations are important. Now, let me just give you a quick idea as to how vaccines work. Now, as we know, it is the immune system, especially as it pertains to virus, that's going to deal with infections, right? So the quicker your immune system can respond, the less chance it has that the infection or the offending organism will have time to replicate. So what vaccination does is that it takes essentially a weakened form of the virus, whether it's live or dead or just a piece of it or whatever. We expose the immune system to a part of the infection, or in this case the coronavirus, right? So we expose it to a portion of it. The immune system recognizes it and says, okay, so we understand that this is what it is, so we are prepared. So when the actual virus or offending agent comes, immune system quickly says, we have seen you before, and then the sequences would have already been prepared and ready, and so in a short amount of time they're able to mount an immune response and eradicate the offending organism, in this case the coronavirus. So that's essentially in a nutshell how vaccines work. Now it is my hope that you never get infected by the virus, but in case you do, this is essentially just like an idea of what will happen. Well, one of the first things they'll do is that they'll test you. And there are two ways to do testing. And the most likely one that they'll do is that they will do a nose swab, right? Or a nasopharyngeal swab that goes down a little deeper. So it's either just at the beginning part or way down. And they've even developed a new one now, a spit test that they spit into a bottle. Those tests will give you like an idea if there's active infection. You can also have a blood test done, which will more likely show you if you had an infection, because it's basically they'll be looking at a portion of the immune system to check if you have developed antibodies. So those are the two tests. They can either do a blood test or a nasal or nasopharyngeal test or a spit test, all right? So if you do get infected or are suspected of having the coronavirus, that's a test that would be done. We are entering the flu season as well shortly, and so they have developed kits that will be checking for the flu as well as the corona to differentiate the two, because there are going to be I would say some confusion coming up shortly, but it's not too scary or anything, but that's what's going to happen. Now, if you do get infected after you have been tested, in most cases, what will happen is that your doctor will recommend that you home quarantine, meaning that you'll go to a portion of the house like a room or the basement or the attic, or somewhere you can be by yourself to quarantine, and you'll try not to interact with the rest of the family. Or if you live by yourself, then you will just stay at home, right? And most of it will include just resting, keeping yourself well hydrated, and taking tablets to help with like the fever and if you're having any pains and that type of thing. Now, you know the areas that it affects, and no one knows your body better than yourself. So if you're being home quarantined and you find that symptoms are worsening and you feel that it is not something that you can manage on your own, or if you have any uncertainty, please feel free to call your doctor or whoever is caring for you, or revisit the hospital to get further treatment. Some symptoms, and I'm just going to highlight some obvious symptoms, like if you have chest pains, shortness of breath, or you really are unable to just move around to care for yourself, and if you feel super dehydrated despite trying to hydrate yourself, a fever that is you're unable to treat that fever just won't go away, symptoms like that. And I mean, there could be other combination of things, but you know yourself, and if you know that you're not improving and getting worse to the point where you're getting to a point where you're unable to care for yourself, definitely seek medical care in terms of going into the hospital or to the doctor that you initially saw. Now, again, I really hope you don't get to this point. If you get really ill, then you'll go into the hospital and then the doctors will care for you. I won't go too much into what is done at the hospitals, because each medical systems will have different protocols as to how they treat patients. So the hospital care, I won't go too much into it, but which is why all the things that I've told you before in terms of prevention and boosting your immune system and that type of thing is to prevent you from going to the hospital, because in my opinion, the hospital is the last place you want to be at this point in time. We're at the end, so let me just quickly summarize. The coronavirus, as we can see, is highly contagious, can be quite fatal as well. And we can be responsible by taking the various precautions. We have the vaccines to look forward to in terms of means of control. And to be honest, the human race has been through a lot, various deadly infections before, wars and various things. But we have always overcome. And I do believe that we are going to overcome this as well. And it's also a time for us to be creative and innovative. Someone once told me that never let a crisis go to waste. Well, stay tuned for my future video. I believe the next one will be on vaccines, because I think this is going to be important in getting this coronavirus under control. So I'll see you then. Peace be with you.